Hey folks, it's Dr. Sam, and I want to share an exercise called Plus Lens to Blur. And this is a wonderful exercise that I've developed that actually can help people reverse their myopia. So this is what you do. You go to a drugstore and you get the strongest magnification lens that you can get. This is a lens that you get for reading. I would get the power of at least plus 250, plus 3, plus 350, whatever you can get in terms of magnification, because you're going to use this as an exercise lens. Okay, so then the way the exercise works is you're sitting in a safe place, like a room, like your bedroom or someplace. You don't want to wear any corrective lenses. So no contacts, no glasses. I know it's going to be blurry. It's okay. You put your patch over your left eye and you get a baseline on how blurry it looks out there in the room. And then you take those blurry glasses and you put them on over the right eye, which is the eye that you're looking through. And I want you to notice immediately your thoughts and feelings when you experience this level of blur. This is a lot of blur. Because there's a tendency that what happens is that we develop our myopia or nearsightedness as a way to avoid the blur. We're afraid of the blur because when we're in blur, we could feel out of control, we don't understand what's going on, we could get hurt. There's lots of things that can happen when we're in that blur. So the way to break the habit of your nearsighted glasses is to wear this magnification lens, and the goal is for you to love the blur, so to embrace the blur, to notice what you don't like about it. Notice how you feel in your body, if you notice any fear or tightness or tension. This is, this is a way for you to begin to relax into the blur, because there's some good things about blur. Blur is about relaxation. It's about letting go. It's about not having to get it right. It's about being more intuitive, more creative, more in flow, more receptive. And so you wear this lens for about a minute, and then you take them off and you notice immediately it's going to be much clearer for you than when you first started. So here's a principle. The way you heal your nearsightedness is by going into your blur. Now, of course, the context is you're doing that in a very safe environment where there's zero visual demand. So I don't want you to do this when you're driving or if you have to do anything where there's any visual demand. This is done in a very safe environment. Okay, round two, you put the glasses back on. You notice your comfort zone around the blur again. The idea is that it's going to spread the light into areas of the retina that you normally don't access, and it's going to be blurry. Your job is to relax into it as best as you can. Surrender into it. After a minute, take it off. You're going to notice, whoa, it's even clearer. Okay, once you make that mental note, put it on again the third time, wear it for about a minute, and then you take it off, and you're going to notice your right eye is very clear. Now, the next thing is that you're going to take the patch off the left eye, and I want you to notice both how bright it is and how clear it is. So the eye patch is there for you to disrupt your habitual pattern around your corrective contacts or glasses. Because whatever corrective lenses you wear based on that 20/20 eye chart, it embeds a habit. I always say our eyes are like pattern addicts. They love patterns, they love structure. The thing is it tenses and tightens our eyes and it makes our eyes worse. So when you wear this magnification lens by patching the left eye and experiencing it with the right eye, and you do it 3 times, you're going to notice that the right eye is going to start to see clearer, and when you take the patch off the left eye, you're going to notice, wow, things are really clear. Okay, so now you're going to patch the right eye. You're going to do the same thing with the left eye. You're going to get a baseline on how it looks out there. It's probably pretty blurry. And then you're going to put those blurry glasses on over the left eye. Ask yourself how you see, how you feel. Be with it. Just notice your thoughts, your feelings, okay? And then you're just going to hang out with it. Notice what you don't like about it, okay? After a minute, take it off. You're going to notice the left eye is probably going to see it a little clearer. Put it on again, and you're going to experience the blur for a minute. Take it off again, and then you do it a third time. After you take off the blurry glasses the third time, then take the patch off the right eye, and you're going to notice that things are very, very clear. And if you do this exercise for 30 days, I'll give you the 30-day challenge, you're going to find that your current habitual distance glasses prescription is going to reduce. And you'll know that because when you start wearing it, it's going to feel too tight on you. It's going to feel tense. And this is when you go back to your eye doctor and say, hey, can you make me a weaker prescription? Can you make me a prescription where I'm seeing the 20/40 on the eye chart? And that is a way for you to begin to reverse your nearsightedness. The stronger the lens that you wear in terms of corrective glasses and nearsightedness, the tighter it makes your eyes, the more it cuts off the circulation. So what you're doing is you're improving your vision. Even if you're getting older, even if you've had a diagnosis, you can do it. Okay, that's my message for today. Go to work.